Welcome to the Strengthening Care and Support Services for Adolescents Living with HIV webinar series. This webinar series is presented by Amanda Ely and Magda Conway from the Children's HIV Association in the UK. This webinar series was pre-recorded in English and sent for translation into Russian. Whilst the webinar is being aired, the authors Amanda and Magda are present whilst you receive the webinar in Russian, but we will be live to present, to respond to questions at different points during the webinar series. This is the first one in this series, and we very hope that it runs smoothly with these translation considerations. The first webinar is focusing on communication, and in particular, thinking about communication as it relates to child-centred practice, to communication models and theories, naming HIV to children, and communicating with parents and guardians. At the end of this webinar, we will ask you for any ideas and particular suggestions of future topics you would like us to cover, as we'll be covering 4 webinars in total. I'm going to begin with some talk around child-centred practice and in particular communication. Thinking about what is child-centred practice, what we're really talking about here is acknowledging that children have rights. And we're arguing that children should be placed at the centre of our concern and that their needs and their interests are your paramount concern when you're working with them. And importantly, it means that children have a right to participate. So we want children's voices to be heard, and that actually they need to be having a say in decisions that are being made about them. And this really does require adults to be comfortable and able to hand over some of their own authority to children in the right context so that children can actually have a view and influence some of the decisions that are made about their lives. And this is really at the heart of child-centred practice, is children's ability to participate. And in relation to health, we're thinking of health as something which is a child rights issue, but also, in addition to that, the information that is needed by children to enable them to support their own good health is actually a child rights issue as well. And so in this approach and from this perspective, we're thinking about a child who is seen as or constructed as being a competent, knowledgeable and capable person. And that through this approach, what we're trying to do is empower children. And we believe that through that empowerment, they are actually best placed to be able to affect change in their own lives. We know that caring for adolescents with HIV is complicated. Many of them have complex lives. The HIV and or the social situation in which they live can present some difficult psychosocial issues that can impact on their ability or their capacity to engage with health services, and also how well they are able to look after themselves. Social circumstances, family life, mental health, substance misuse issues can be very significant for this group. And it's critical to think about these wider issues when we are trying to support them and care for them, and making sure that they feel involved so that all aspects of the child life are being considered and not simply their clinical engagement, their adherence and their health outcomes. Because what we're saying is that these wider issues are going to have significant impact on these factors. And in addition to the wider social context that is important to understand and can be quite complicated for this group, we also need to remember always that adolescents with HIV don't want to be simply defined by their HIV. They want to be understood as a whole person. And when working with them, it's very important to remember that and to think about them holistically, think about them as a whole person and treat them as such. So get to know them, understand what's important to them, what are they interested in, what do they like talking about, what hopes do they have for their future, and what are their dreams. So you're really thinking about treating the person as a whole and not simply addressing their HIV related needs. And this is something that adolescents have said that is very important to them. They do not want to be defined simply by their HIV. So when we're thinking about the adolescent from this perspective, holistically, a way in which we can start to understand them and think about the ways in which we might need to respond to their needs is to think about how we assess needs holistically. And it may be that we identify here that the adolescent has many other needs which need to be addressed beyond their HIV, and that actually if we don't address these wider needs, it's going to be very difficult to address their HIV-related needs. And we can think about a child's wider needs in specific ways. We can think about their needs in relation to their family. Are they safe at home? Is family, does their family have the capacity to care for them sufficiently? Are they nurtured at home? Are their basic needs met? Are they fed and clothed and kept secure in their family? And actually looking at family-based needs often highlights some areas where professionals may need to be involved. But also their wider community-based needs. What sort of role do they have in their wider community? Do they have social opportunities to do things with friends and go out? And do they have hobbies? Are they involved in clubs, in sport, in youth activities? What sort of role do they have in their wider community? And is this something that could be supported? Culture, faith, ethnicity-based needs. Are they able to practice their faith of choice? What about their cultural needs? Is ethnicity an issue in different countries? Racism can be a problem. And is this something that you need to understand better about your adolescents? What are their needs in relation to their ethnicity? Their economic circumstances? Is poverty an issue? How is poverty impacted upon them? Are there particular needs arising from this that you need to think about how you can address? And also the wider political context. Are there security and safety issues? Is there issues around, political instability in their context that actually are impacting upon them? And by doing a needs assessment, which is really quite broad, holistic, and considers all these different factors, we really are best placed to make decisions about what might be helpful for a particular young person. And really without this information, it's going to be very difficult to come to any meaningful understanding about who they are, what they might need, and ultimately how meeting those needs may best enable them, empower them to meet their HIV-related needs and achieve good clinical engagement and self-care. So there's some particular principles in relation to assessing children's needs that it's important to remember. Again, the message being here, it's child-centered. The child's perspective must be at the center. What do they think about these different aspects of their lives? What needs might they identify? Where may they identify that there are problems, things that they're not happy about, things that make them feel unsafe? What can they tell you? And their needs are the priority. And it can be difficult sometimes when particularly working with families, as you may be dealing with competing needs and people have got different priorities. And your aim really needs to be keeping this child-centered. And when doing a needs assessment, you're going to need to be able to think about the child's development. What milestones should they be meeting at what stage? What knowledge do you need to have of those developmental milestones in order for you to make an accurate and sufficiently comprehensive needs assessment? And then when thinking about the development, understanding how this may be affected by their experiences. So not solely whether they have a disability or what impacts their health is having on them, but actually we know experiences and social context also significantly affect children and adolescents' development. So understanding their development within the context of their lives is important. And thinking about the process of a needs assessment, this is a comprehensive piece of work, and To enable you to gather in-depth information about a child or adolescent, you're going to need to establish a very good working relationship with them, and where appropriate, their family. This is going to require trust, and building trust in a relationship can take some time. So we can think of assessing needs as an ongoing process. It takes place over time and is not a one-off event. You're unlikely to be able to get the depth of information that's really useful for a needs assessment from a one-off event, from one meeting and completing a form and leaving. It's not going to tell you all that would be helpful to know when you're trying to meet some possibly quite complex needs that a child or adolescent are presenting with. So really think about the needs assessment as something which takes place over a period of time.